Hi, I'm Rachel Wall, founder of Inspired Hygiene, and I'd like to give you some quick tips on this new ADA code, the 4346. So this has been a long time coming. It's been hard to treat these patients in the past, right? We weren't really sure what to do with them. Even it was hard for us to teach it with different configurations of appointments and codes and things like that. And these are those patients that they're not healthy, right? They need something other than a prophy, but yet they don't have bone loss, right? We're seeing bleeding. We're seeing moderate to severe gingivitis, and yet we're not seeing any bone loss, and so we don't really know what to do with these patients. So now this is the place that they will land. So I want to acknowledge first, before we go any further, that we rely on coding experts to give you this information. So we are just the conduit for their information. So we refer to you to books like Coding with Confidence, practicebooster.com, which is an online version of this that's fantastic. Dr. Charles Blair, Dr. Roy Shelburne, Teresa Duncan, Christine Taxon. Those are the folks that we rely on as our insurance experts, and we just want to direct you to them when you have these specific questions. But this comes up, right, all the time. This is absolutely in our wheelhouse, and there are a few things that we would like for you to keep in mind as you begin to use this code. One is beware that this does not become the dumping ground for all those patients that you're just not quite sure what to do with, right? So there are still very specific codes to handle specific conditions, and make sure that you read all those code descriptors and you really do your best to get it right. So for example, this is not the dumping ground now for all the patients that used to put in a gross debridement. This is a different code. This is not the dumping ground for those patients that have bone loss, 4 to 5 millimeters or deeper pockets, bleeding, but I don't really want to tell them they have periodontal disease yet. Those folks need to go into therapy, right? If they have bone loss and 4 to 5 millimeters or deeper and bleeding, they need to go into active periodontal therapy. This is truly for those patients that have moderate to severe generalized gingivitis, right? So bleeding, redness, they can have pseudo pockets, but they don't have bone loss. All right, so beware that we're using this code for the appropriate patients. Number 2 is do your perio evaluation as early in your appointment as you can. So I know I have a routine that I follow. It helps me really stay on track. I typically, after I have asked the patient if they have any questions or changes, then I go through the medical history review, and then as soon as I lie that patient back, I typically start the head and neck exam and the oral cancer screening. Well, let's say this is a new patient. Let's say this is a patient that's been out of the practice for a long time. Let's say I read in the notes that they have a history of a lot of bleeding and inflammation. So those are giving me clues, and I might instead just want to do a real cursory look at the tissues, and then if I see some signs or if I have some hints, I'm going to start first with my perio exam. I might even do that before I do the x-rays, and I'm going to tell you why in just a second. So let's say we do that perio evaluation really early on, and we say, yep, they have moderate to severe generalized generalized gingivitis, and we want to do this gingivitis therapy today, and the patient agrees they want to do whatever needs to be done today. Then we need to get our doctor's approval, right? We're going to have to call doctor in and have doctor approve and confirm the diagnosis. So we don't want to wait till 20 minutes into our visit to have that interaction. What if doctor's in a detailed procedure now? We have to wait another 10 or 15 minutes. Now we're halfway through our appointment. So if I can do this perio evaluation as soon as I can in that beginning of that appointment, then that's going to give doctor time to come on in. That way, if I call doctor and I say, doctor, I'm going to give them a code word. That's number 3. Give your doctor a code word. I'm ready for the periodontal evaluation now. This way they know, hey, Rachel is expecting that we're going to be presenting this periotherapy, and she thinks it would be appropriate to begin treatment today. I need to go ahead and get on in there. But again, what if they're in the middle of a procedure and they can't get up right away? Well, if I've done my perio evaluation early, then I can sit the patient up and I can do x-rays. I can take photos, right? We need to have photos with this code. I can take my photos. I can do the oral cancer evaluation. I can do all of those things that I would need to do anyway while I'm waiting for the doctor to come in for the exam. And so I am using my time to the best of my ability and really managing it well. So please, we'd love to hear your questions, what you're hearing about this code, what you're seeing in your practice about this code. We'd love to know what you're experiencing and how we can further support you with this. So until then, take care, and I'll see you next time.